There's a big difference between something looking okay and something functioning okay. It kind of looks like they're faking, right? They're kind of trying to like, oh, I can't keep it open. That's a reflex. That's not something they're intentionally doing.
Around this time last year, we had a guest that we all loved having on, a guy who does a brilliant job on YouTube, social media, way smarter than all of us. His name is Dr. Brian Sutterer, MD. He is a doctor who specializes in sports medicine. Anytime there's any kind of injury in the world of sports, anytime, Cam Scatabo gets hurt. Literally 30 minutes later on his YouTube channel, there's a 15-minute breakdown. I don't know how he's wearing a suit and tie, but he's got it all with pictures and with skeletons and with x-rays, all kinds of stuff. And he was all over the Tom Aspinall story as well. So we thought it would be very interesting to talk to him about what transpired on Saturday. He is kind enough to join us, I do believe, during his lunch break, right? This is your lunch break in between saving the world.
Yeah, that's right. In between, people wonder, are you just on YouTube? No, I have an actual job. So yeah, it worked out well. I appreciate the invite and getting a chance over the break here to talk a little bit about what we saw this weekend and then recently in the UFC.
Yes, thank you so much. Your insight is unbelievable. By the way, I might try to squeeze in a George Springer. Was that an oblique? I don't know if you're a baseball fan, but I'm very worried about George Springer. He left the game. I don't know. Did you see that? Or did you stay up till 3 a.m. to watch the World Series?
I did not stay up till 3 a.m. to watch.
Okay.
So yeah, you'll have to fill me in a little bit. Maybe.
Okay, something weird happened there, and I'm very worried as a Jays fan, but we're not here to talk about that. We're here to talk about fighting and Tom Aspinall in particular. You did a great breakdown. I urge everyone to check it out on your YouTube channel. Tom Aspinall gets poked in the eyes multiple times. Earlier in the fight at the 149 mark, failed takedown attempt, but then the big one, the double poke, if you will. And there's been all kinds of theories as to whether or not he was telling the truth, quitting, faking, all that stuff and more. From your vantage, and I know you weren't there in Abu Dhabi, but from your vantage point and from your expertise, what did you see? How was it all handled?
What I saw was a mechanism, a moment, a foul, right? That clearly can cause, even if it's not specifically a big, bad, severe injury, can clearly cause enough visual impairment that the fight should be stopped. And that's really what I think you have to focus on. Everybody seemed to be latching onto the fact that, even at the hospital afterwards, right, the doctor said, well, there's no serious damage. People saw that his eye visually looked okay. The doctor that was there covering the fight said the eye looks okay. And there's a big difference between something looking okay and something functioning okay. And when you get knuckles dug deep into your eyes, not just on one side, but on both sides, that is plenty force. That's plenty trauma to cause your eye to not function the right way, even though it might objectively look okay when the doctor is there at the ringside examining it. And so I think it was handled perfectly. I think, yeah, the eye visually looks okay. But in those circumstances, you have, number one, a foul, you have a mechanism of injury, and you have a fighter that's telling you symptoms. It's telling you they can't see. And if you can't see, you can't protect yourself. If you can't protect yourself, the fight can't continue. So it seemed very, very straightforward to me.
And so when he says he can't see, what exactly is happening there? What is the injury that is causing that?
There's a couple of possibilities. The most common thing that you'll see with an eye poke is what we call a cornea abrasion, a corneal abrasion. So the cornea is the outermost layer that goes across the front of your eye. It's a clear, thin layer of cells. And if you take a finger, some dirt, even just a clean finger, and you scrape it across the front of the cornea, you will actually you'll cause trauma to that layer of cells on the cornea. That's a corneal abrasion. And so that's going to be the most common injury that you'll see when somebody gets an eye poke. And there's a reflex that happens that you cannot control where your eye wants to close because it's experienced a trauma. Your body is designed to protect yourself. And so whenever you have trauma to the eye, your body doesn't know where you're doing. It's designed to react and protect itself. And so there will be a reflex that you cannot easily overcome where the eye wants to close itself. You'll have tearing that occurs, and the tearing can cause the vision to look very blurry, right? If you squirt a bunch of water in your eye and try to open your eye, everything looks blurry and fuzzy, right? Because of all that water. So the tearing in the eye is going to be a reflex that occurs in response to the trauma. The eyelid is going to want to close and stay closed. That's why you see fighters really struggle with it kind of looks like they're faking, right? They're kind of trying to I can't keep it open. That's a reflex. That's not something they're intentionally doing. It's your body trying to protect the eye from more injury. And just the damage to the cornea itself can sort of cause the light as it enters the eye to get refracted in various abnormal ways where your vision might look more shimmery, it might, be more blurry in spots where you're not seeing as clear. So that's if this was a corneal abrasion, which would look on visual inspection completely normal. The other possibility is just the direct pressure going into the eye. So let's say your eyelid is closed, but a finger goes directly into the eyeball. You can think of it like a concussion to your eyeball, right? So we know with a concussion, there's this force of energy that gets transferred into your brain, into those brain cells, and causes disruption in the brain cells. Think of it almost like a concussion to the eye. When the finger gets poked, that energy is transferred through the meat of the eyeball and can cause damage to the retina, which is the layer on the back side of the eye. And it can cause this temporary stunning, so to speak, where your vision is going to be blurry. It's going to be distorted just from all that direct pressure going into the eyeball as well. So those are probably the two most likely things that were causing him to be able to say, yeah, I can't see. And then, of course, you can't continue the fight if you can't see.
You often hear about torn retinas. There's a famous case of Michael Bisping who tore his retina. He lost his eye. Is that the worst thing that can happen? Could that even happen as a result of an eye poke, or would that have to happen over a sustained amount of time?
That can happen. That's definitely not the worst thing. You can get a true open globe where the eyeball literally like ruptures.
Wow.
Like what it sounds like, where the eyeball pops, so to speak. That's going to be the worst thing that would happen. A retinal detachment is definitely a serious thing, but it's a treatable thing. And so if you noticed in that video that Aspinall shared, when they had his head kind of sitting up in that apparatus and there was a light that was being shined in front of his eye, what they're doing there is they're looking in the back of his eye. They're looking at the retina to make sure there's no evidence of a retinal detachment, because that's probably going to be one of the more common, serious, but treatable injuries that would occur with an eye poke.
Okay. Yeah, I'm happy that you brought up the interactions in the cage, because you could hear the cage side doctor saying like, oh, it looks fine. And everyone has run with that and said like, even the doctor said it looks fine. If we could just expand on that, he's just talking about the fact, correct me if I'm wrong, that like the ball isn't out of the socket, right? That's the only thing that he can see in that moment.
100%. Yeah, he's just talking about, hey, the eyeball looks normal, but you're not going to be able to see in the back of the eye there ringside. You're not going to be able to assess to see if the retina is detached. You're going to look, you're going to make sure, hey, the eyeball's not hanging out. A simple thing that you'll see docs do ringside or even in other sports when somebody has concern for an orbital fracture is whenever they move their finger to the side and they have somebody follow with their eyes, what you're doing there is you're making sure that the eyes are moving together, because if you have an orbital fracture, sometimes the bone can trap the muscles that are deep inside the eye socket, controlling the eyeballs. And objectively, the fighter, the athlete will complain of double vision because the eyes are slightly off sync from one another. And oftentimes, especially looking upwards, they'll do that. And if one eyeball does not move upwards, that can tell you that there could be an orbital fracture where that muscle is getting pinched or trapped because of the socket. And so that would be one thing that visually you might see in terms of the function of the eye. But to diagnose a corneal abrasion, you have to take a specialized dye and you put this green fluorescent dye on the eyeball and then shine it with a specific UV lamp. And that's how you would diagnose a corneal abrasion, but you're not going to be able to do that at ringside. So he's correct. It'll look normal, but that doesn't mean it's functioning normal.
I wanted to ask you about an interaction that he showed on his video blog of him at the hospital, because I give Tom a lot of credit. I thought that he was going to explode on everyone there because it seemed like they weren't quite well equipped to take care of an injury like this. I'm going to play you the clip and then get your take on it, on the interaction. Here it is.
What's about your vision?
I can't say.
I have to check.
Okay, go on. It was actually both eyes, but this one was. We did like that.
What is his name?
What did I say? Okay, I'm very sorry.
Oh.
When I pull up or what?
Just
or
burned.
when I put the light
Yeah,
in?
with the light.
With the light. Okay. Now we can cover it again.
Okay.
There is no external features of trauma yet. Okay.
What did you make of that, doctor?
Yeah, that was super interesting. I hadn't listened to all of it before, but I love, it's funny. There was a comment in there, I think I heard on a different clip of one of the providers there was asking like what happened.
Yeah.
Like clearly they don't understand. And I love that, because I think sometimes if you are only around medical providers who intentionally like know the sport and know what you're doing, sometimes you can get biased. And so the fact that they went somewhere where they are treating everybody who walks in there equally. It doesn't matter if you were like horseback riding or UFC fight. evaluating the eye is evaluating the eye. And so they're, in a sense, able to remove all subjectivity from it and just focus on the objective. What's wrong with this eye? There's somebody here in front of me in the hospital who's got an eye injury. Let's evaluate their eye injury. No bias to, oh, he's a fighter, he needs to be tough or whatever. Bias completely removed. And so I thought that was actually kind of good to see, that there wasn't that sense of, oh, you're tough, you'll be fine, and just objectively focus on it. When she shined the light in his eye, right? So she asked him, was it when I pulled it up, or was it the light? And I think that is helpful, because if it was from just moving and pushing on the eye, that could suggest more trauma to the structures. When it's pain from shining the light in the eye, one of the things that can happen, as I mentioned, that sort of concussion of the eyeball, you can get this almost electric overload, this circuit overload of the retina, because the retina are cells, and the light comes in, it hits those cells. Those cells send signal back to your brain, and the brain processes it. And if it's overloaded, it can be just hypersensitive. And so then if you go and you shine a bright light at it, it's already kind of on high alert and over amplified with getting XF electrical signal. And so it would make sense why the light would bother. It's the same way when somebody has a concussion, that the light can be more sensitive to them because of how it stimulates the brain. In this case, it's the light stimulating the retina, probably from that trauma that was just parted through the eye into the back of the retina.
I know this is a tough question to answer. What do you think he is feeling today? How much pain? Like, how long will something like this last?
Yeah, so if it's just a corneal abrasion, typically within a few days or a week, they're feeling quite a bit better. I assume by now he's probably back home. I guess I don't know for sure, but I assume they will repeat these tests. They'll probably go in and, I don't know if he was able to see an eye doctor at the fight location or not, but I'm sure he'll see another one when he gets back home. They'll repeat these exams, because sometimes things can change. Sometimes you might not see it right away. And so they'll reevaluate these exams. He's probably feeling a lot better. His vision is probably starting to clear up. I wouldn't expect it to be 100% resolved yet, but assuming they reevaluate, there's no damage to the retina, there's no damage to the globe, and his visual acuity comes back, I would expect him to be fine in a matter of weeks and be back ready to fight, assuming there's nothing else that they find with the rest of his, possible post-fight injuries.
And do you think there's any chance that this can linger, that this could be something that could last 4, 5, 6 months?
Yeah, I don't think so, unless they find something new. If they find, sometimes you have to do surgery for a detached retina or whatnot. So if they found something like that, then yeah, that's a different story. But assuming all the tests continue to come back normal, I wouldn't expect his eye to be, more sensitive to this or anything like that going forward.
Do you think he made the right call based on like how serious this could be to not continue?
Yeah, 100%. I think too, right? I'm a fan. It's disappointing to watch it and see and the fight not continue. But, number one, the thread that they walk at that sport is so tight that losing one fight, one injury can change your entire career trajectory. And so I think you always have to err on that side of the fighter making the right decision of, hey, if I can't see, yeah, I might be tough, but toughness doesn't necessarily pay the bills, and toughness doesn't get you another title chance. If you decide to go out there and fight with one eye and then you lose or get a different type of injury, he's coming off, he's had bad injuries, right? And so I think in that moment, absolutely, he made the right decision. You can't see, you can't protect yourself. And so why even set up that potential to do more damage to the eye, do more damage to something else, and then completely alter your career trajectory.
While we have you, just wanted to ask you about a couple more, and I understand you're pressed for time, so I don't want to keep you too long. That fighter that joined us right before you came on, Quillen, knocked out his opponent, Nasrat Hakparas, and it was very scary because Hakparas was on the canvas face down and his legs were convulsing. What do you think he was experiencing there? And when you see that when I see that as a fan, I'm like, holy crap. When you see that as an MD, what are you thinking?
Yeah, when I see the impact, we call it like an impact seizure. So if you watch football, we've seen it in the UFC and boxing, people go into this fencing response where, one arm is kind of outstretched from the other. Basically, what you have to remember is happening is that the brain functions on electrical signals. And so when the brain is sending signals between all these different neurons, it's electricity that's mediating all of this. And so whenever somebody gets a concussion, a brain injury, that whole electrical circuit just gets completely thrown out of whack. And sometimes parts of that electrical circuit get overactive and discharge abnormally. And what you're seeing is basically a sort of seizure response. It's a response to the impact in those brain cells where parts of the brain are hyperactive, they're overactive, and just sending all these signals down to your muscles to fire, to fire, to fire. and it expresses itself externally in various ways. Sometimes it's the classic one arm out extended fencing response, which is actually a callback to a reflex we all have as kids, where whenever the neck kind of gets turned to one side, you reflexively put your arms out to protect yourselves. So sometimes we see that. Sometimes we just see seizure activity. But I certainly think of more trauma to the brain. And the longer that somebody is unconscious, there has been plenty of data that compares that to outcomes long term. Some look at, unconscious for more than a minute. Some studies will say more than 5 minutes. But we do know that the longer you are unconscious, the more that can correlate with a worse long-term outcome because of more trauma that was imparted to the brain and it taking longer for everything to reset and, for that computer to reboot, so to speak.
I went to a bare-knuckle fighting championship event for the first time earlier this month, and every single person that I spoke to there were telling me this is a lot safer than MMA and boxing because while it might look like a little gruesome cuts, it's all superficial. They were telling me, like, we're not getting repeated blows to the head, kicks to all that stuff. This is just punching, and because you have to protect your hands, you're not wearing padded gloves. It's actually a lot safer. It's actually a lot less, damaging to your body. Do you buy any of this? Do you feel like there's anything to that?
I think there's some truth to that. A similar analogy you'll hear is talking about if you want to get rid of injuries in football, take away the helmets. Because, right, if you don't have a helmet on your head, you're not going to be lowering your head and trying to hit people and use it as a weapon. I think it's a different type of injury that you have to look at. Number one, I don't think we have a long enough stretch of data with bare knuckle boxing to compare it to the data we have with traditional boxing or with mixed martial arts. And so it's a much smaller sample size. I do think, though, that if I recall, the last I saw that data, there is decreased concussion compared to equal exposures in other sports, but you have increased other injuries. So you have way more hand fractures, you have way more lacerations, way more potential for orbital fractures, that superficial trauma. So yeah, you're kind of trading off one for the other. You're saying, well, would I rather have this injury or that? I think it's hard to put those two together and say which you would rather have. So I do think there are a different set of risks in bare knuckle compared to traditional boxing. None of it obviously is going to be completely absent. It's just which type of injury risk you want to have higher, the repetitive blows from the padded gloves or more of the hand fractures, the facial trauma from not having that cushioning to protect things.
Okay. There's a guy named Ben Askren who had to undergo a double lung transplant, and he's an unbelievable human and specimen and athlete, Olympian, Dan Hodge Trophy winner. And there's a part of me that thinks that he's going to try to compete again in some way, shape, or form, because he's talked about examples of people. These are some, videos of him kind of relearning to walk and whatnot. Could someone conceivably do that? Could he compete in a wrestling match? He was planning on doing so before this occurred to him. He had pneumonia and he had like a staph infection that led to pneumonia, and the lung collapsed. All this stuff that I'm not explaining very well and medically well, but is that a crazy thought, or do you think someone of his caliber could actually come all the way back and compete again?
I don't think it's crazy at all. In fact, the sports medicine doctor in me thinks that's an exciting thought and something that, would be really good to have that motivation and inspiration. There's a lot of factors at play there. I think, number one, when you were first saying coming back, I thought mixed martial arts, boxing, I don't know about that. But then wrestling, right? Wrestling is not going to be nearly as high risk. And so then assuming that they can objectively test his lung function, his heart function, and it all is, up to snuff and functioning well, I don't see any reason why he couldn't. In fact, I think he probably has that motivation where he'd be more successful with it. The harder part, the bigger unknown. So sometimes when people are, he obviously looks very different. He's lost a lot of muscle mass. That could simply be from how long he was in a hospital bed, right? You lose a lot of muscle mass even after just days of being in a hospital, let alone weeks, months. Sometimes people will also get actual like muscle damage, myopathies, kind of nerve damage from long-term illnesses. And those can be harder to recover in terms of just, well, do you need to just work out more versus is there actual underlying muscle or nerve damage that's going to take longer to recover? So that's probably the bigger question is, was there something else that went on to the muscles or the nerves? If not, then yeah, it's just a matter of time until hopefully his lung function recovers, his cardiac function is okay. you can objectively test those. And once they are okay, they'll probably want him to do exercise to a certain degree. And then assuming everything is checking out, it's functioning well, he's not having, who knows what actually was going on with his heart, for example. Yeah, there's nothing from what we know so far that I would say he should not or couldn't work back towards being an athlete in whatever respect he wants. Yeah.
Wow. What a thought. Okay. Last one. I know I'm putting you on the spot here, but perhaps you'll do a video on it. Everyone's wondering, will George Springer be able to play for the Game 4 tonight or the rest of this year? Here's the video. Can you tell me what he's experiencing? Here's George just swinging, and now all of a sudden you can see he's wincing, and he leaves. That's it. He's done. You see him. He's favoring the right side. What did he experience here? What could he have possibly experienced? They haven't told us if he's available tonight and what that was, but he's gone after this.
Yeah, so it's probably one of his oblique muscles. Basically, the obliques are the muscles in the ab that work on rotation. So your rectus abdominis is the straightforward squatting and doing a sit up. The obliques are important in baseball because that's the twisting that gives you the rotational force. The first thing I was looking at is what part of the game was it. I don't like that it was the 7th inning in a tied game and he pulled himself out, because now we're thinking not so much is it safe for him to play, but can he functionally play? I think it's probably safe for him to play with an oblique injury, but the bigger question is what's his function? Because if he can't swing a bat because the pain is too high, then no, I don't think we're going to see him. And so I don't like that he pulled himself right away and did not continue in a very close game. I would give it a coin flip if we're going to see him again. I don't think this is anything big long term. And if I were managing the team and it's an oblique injury, I'm doing whatever I can to get your pain under control, knowing that we've only got potentially 3 or 4 more games left here in the season. But you can't really numb a muscle necessarily, right? You can't really numb a hamstring strain, a muscle pull, like you could numb, say, a rib fracture or a rib contusion, joint injury. So seeing that so far, I'd probably be less than optimistic, unfortunately, for him to be back right away.
Man, I can't thank you enough. I feel so much smarter just speaking to you for 20 or so minutes. Really appreciate it. Keep up the tremendous work. Your YouTube channel is a must-watch. Your Twitter feed a must-watch. Dr. Brian Sutterer, MD. Really appreciate the time, the insight. It's a great privilege to have you on just for a few minutes, and keep up all the amazing work over there. It's really wonderful to watch. And it's, by the way, it's just amazing how quickly you get the stuff up. I don't know if you're just watching everything or what, but your work ethic is inspiring as well. So I'll say that again. Much respect.
Appreciate that.
Thank you.
Yeah, thank you very much. Always happy to come on and talk with you. So anytime.
Thank you so much. There he is, Dr. Brian Sutterer, MD, specializing in sports medicine. Really fun. I enjoy those conversations very much. I hope you do as well. It's great to hear from an actual smart person, a professional, an expert when it comes to these matters. It's weird. Sometimes when we're talking about the injuries and whatnot in the back, Frank likes to pretend like he's an expert because he spends a lot of time on Reddit, but it's nice to speak to an actual expert, Thanks for watching this video. Before you go, if you haven't already, hit that subscribe button for us. Also, give us a thumbs up, leave a nice comment. These things go a long way. And while you're here, do check out the rest of the channel. We've got live shows and full interviews, clips, and a whole lot more. We're doing big things here, and we appreciate your support very much.